Well, I think that there have been a number of major advances over the last several years in the lymphoid space, and they've been focusing on the identification of new targets and actually the FDA approval of multiple new drugs. I think probably one of the most exciting areas is our understanding now that BCR receptor signaling is playing a key survival role in a number of different tumor types. It's been scientifically suspected for a long time that tumors like CLL were driven by antigens. But I think this has been most clearly shown by the use of some of these new agents that actually target the B-cell receptor signaling. And of course, the ones that really have made the biggest mark are those that inhibit Brutton tyrosine kinase, the drug called Ibrutinib. That drug in CLL has transformed this disease. And it is a life-saving drug. And it was approved about 1.5 years ago. And since then, I think we have seen many people that would have died with disease that was no longer responding to conventional therapy, who are now leading relatively normal lives. Other targets within this same cascade would include PI3 kinase delta, and the drug there that has been approved is a drug called Idelalisib. It's in a little different spot in the BCR signaling cascade, and that too has shown high activity in CLL. Now, these drugs have also now been tested in mantle cell as well, and there is less scientific understanding or appreciation that mantle cell may also be a tumor that's highly dependent on BCR signaling. And again, the very high activity of these drugs in mantle cell, I think, provides very compelling evidence that they too are being driven by this same survival cascade. And another area that has been a little more difficult to go after is that of large B-cell lymphoma, which is actually the most single common type. Now, it used to always be thought that diffuse large cell lymphoma was a single tumor type, and it's fortunate that work that was spearheaded by a consortium called the LLMPP and Dr. Lewis Stout identified back in 2000 for the first time that large cell is not a single tumor type. It's actually multiple different types of tumors. And one of the tumor types is actually called the activated B-cell type, ABC, and that also appears to be driven by BCR receptor signaling as well. And there is a large randomized study called the Phoenix trial, which actually is looking at the drug Ibrutinib with R-CHOP to determine if that will improve the cure rate of previously untreated patients with ABC large cell. So I think that, to me, probably the largest, most important advances really come from this group of drugs. And now we are beginning to see second-generation drugs coming along. They have not been approved by the FDA yet, but there are a variety of different Brutton tyrosine kinase inhibitors that are showing very high activity as well. I think that the potential advantages there is that they putatively have fewer off-target effects, and so some of these side effects may be lower. We're also seeing a variety of drugs that are targeting the PI3 kinase cascade.